Cooper Foundation. And it is really my honor to welcome all of you here today to this beautiful new facility, the John E. Kostic Pediatric Infusion Center. I'd like to extend a warm and heartfelt welcome to all the members of the Kostic family and their friends and loved ones who are here with us today. And thank you for your very generous donation that makes this important new center a reality for our little patients here at Cooper. A few introductions. We have with us today the Kostic family, as I said, and we have members of our Cooper family as well. We have Dr. Michael Goodman, who is the Chief of Pediatrics, who you will hear from in just a moment. We have Robin Harvey, who is the Assistant Vice President of Women and Children's Services and has been involved in the planning of this from the very beginning. When I told her about the family, she immediately came up with this idea because there was such a great need here. We have with us Dr. Post, who was John's pediatrician a very long time ago, well maybe not so long, but a very special thank you. He's here today from the medical school, and Stephanie Connors, who is our Chief Operating Officer, as well as some of the nurses here in the back and staff from the Children's Regional Hospital at Cooper, who really deserve all of our credit and appreciation. So a big round of applause first to our Cooper. We want to say thank you so very much to Emily and to John and Eileen Kostic for raising such a wonderful young man, for your generosity, for your commitment to our young patients, and to other members of the board who are here with us today, Ed Regrudo and John Markowski. So a very special thank you to you for your generosity today and to the community of South Jersey, because you really have made a difference in many, many different ways. Your mission, the foundation's mission to improve the lives of young people is demonstrated here in the scholarships that you give and your commitment to important causes in the community. And from the bottom of our hearts, we thank you. We would all love to live in a world where this center, in fact, our entire children's hospital, would not be needed. But until that time, we are so appreciative of your kindness and your compassion so that we can build places like this to help us care and heal sick children. The Children's Regional Hospital at Cooper is the only state-designated acute care children's hospital in South Jersey. And so that makes us very special. And it's our goal here to provide exceptional pediatric primary care and comprehensive specialty care for our patients, for our families, in an environment that focuses on the patient and his or her family. This new Pediatric Infusion Center really just continues to add to the comprehensive care that we're able to give. We have a level 3 neonatal intensive care unit. We're the only hospital-based pediatric surgery program in South Jersey and the only level 2 pediatric trauma center in South Jersey. We are really South Jersey's special place for children. We train physicians at our medical school, and we have Dr. Post from our medical school who is here with us today. We know that the needs of children and their families are different than the needs of adults. And this space was designed with their needs in mind. It's bright and colorful and cheery. And as you'll see when we go inside, we've carried that theme inside. And so we certainly hope that this is a place of comfort and caring for the families. This new Pediatric Infusion Center is a lasting memorial to John. It continues his legacy. Everyone who knew him talks about how kind and caring and what a very special person he was. And his legacy will live on here as hundreds and thousands of young patients and their families are taken care of and heal in this facility. We understand that giving is part of life, and you have given to so many by your generous, generous gift here today. I talked with Emily a bit, and I asked her to just talk to me a bit about John, because she's his little sister. I thought that her words in describing him really were just perfect. I'm the big sister in my family, but she said he was a stand-up guy, and what better compliment could you give someone than to be a stand-up guy, somebody that you could trust, somebody that had compassion, somebody who lived a life of joy and didn't let things define him other than his own goals and aspirations and dreams. And so today, we continue that legacy with our tribute to all of those who come through this facility and find hope and healing, compassion, and a cure. So, as we say thank you, I'd like to call first upon Dr. Michael Goodman, the Chief of Pediatrics. We'll then have Robin, and then we'll have Emily from the family, and then we'll take a look outside, because this is only the welcome area. It is not actually where the patients go for treatment. Michael?
Thank you, Susan. I just want to thank everyone here, particularly the Kostic family, your foundation, our staff, on behalf of the Children's Regional Hospital, the faculty, the residents, the nurses, and our entire community here at the Children's Regional Hospital at Cooper, for your kind and really, really thoughtful donation and support of our program. I don't want to reiterate a lot of the details that Susan just described. In our Children's Regional Hospital, we are the only place for high-level pediatric care to be provided in this region. But what I really wanted to focus on was just, I didn't know John, but I read some descriptions of John on the internet. The internet has everything, and you believe everything in the internet, but when the internet is written by his mother, you sort of have to take that as gospel. And one word, one line just really struck me about John. Aside from all the wonderful platitudes and just a wonderful young man he sounded to be, it's literally like a Boy Scout, an Eagle Scout, you know, trustworthy, loyal, helpful, friendly, all those attributes. But he said something, you said something about him, that everybody has something. And that in our materialistic world nowadays, everybody has something is usually material, and everybody has something. But he looked at that as everybody has something as a burden. And you are allowing children that have burdens, have illness, have difficulties and problems, be supported in a way that they can't get anywhere else in this region. Now, we know that there are other children's hospitals across the rivers, but care is best when it's given local. And as the Children's Regional Hospital at Cooper of South Jersey, the only program of this nature in South Jersey, children can now get high-level infusion care as an outpatient right here in our facility, and they don't need to travel far from home, which is really the most important part of healthcare, is having the family around. And your family embodies that tremendously. So with that, I will, again, thank you all for your contribution, everyone out here for your support, and I will turn it over to Robin Hardy.
Thank you, Dr. Goodman. Thank you, Susan, and to the Kostic family. What a great day for the Children's Regional Hospital at Cooper. With this generous gift, children will receive safe, comfortable, convenient infusion therapy in a space that is designed to specifically meet their needs. Giving medications or other treatments, such as giving blood through an IV or getting a test, no longer requires a hospital stay. This facility will allow kids to have their treatment quickly and return home the same day. Less time spent in our facility means more time for them to be kids, to get to play, to get to sing, to get to be with their families and friends. Utilizing state-of-the-art equipment we will treat our patients safely and effectively. Our processes have been streamlined so that the family simply can check in, come right here to the Kostic Infusion Center, and receive their care. Currently, the infusion room is staffed with a certified, registered nurse specifically trained for infusion therapies who will work very closely with our pediatricians and the physicians who work in our pediatric specialties. Because of the John E. Kostic Memorial Foundation and your donation, we now have a beautiful, child-friendly, comfortable environment, decorated with all of the colors, a dry erase wall, and the comforts of a recliner. We also offer within our center a stretcher for longer infusions and for children who are unable to tolerate sitting in a recliner. Our children will have all the comforts of home. They can watch TV, read, play video games, and will also have access to all of the services of our Child Life team, including play therapy, distraction, and developmental preparation for their infusion. I would like to take a moment and thank all the teams and individuals that helped lead the way to get this fantastic center up and running today. A big shout out to Michael Pagan, Kate Mariotti, Thierry Martin, Michael Kessler, and Stacy Weber and the rest of the information technology team. What you can do in the electronic medical record is phenomenal. Thank you to Dr. Drake and to the pediatric specialists, including pediatric endocrinology. Without your support and expertise, we could not have had this service here today. To the nursing leadership team, Susan, Joan, Jackie, and Marina, what amazing preparation. Thank you to the pediatric pharmacy for your teamwork and workflow guidance. Thank you to Brenda Brown, our infusion nurse, for your preparation and for your excellent nursing care of our patients and the guidance and education you give to their moms and dads. And a thank you to Joanne Fox, our project manager, for your leadership and innovation. You have done great work and hundreds of kids will benefit from your expertise. Finally, thank you again to the Kostic Memorial Foundation. Without your generosity, none of this would be possible. Again, what a fabulous day, and to all, welcome to our Kostic Infusion Center.
Thank you to both Robin and Michael. Just one last thing before Emily joins us. This is the waiting area where we're standing. We did have to move the furniture out, but there is like a children's play table that is typically here, as well as some other seating, so that even while the children are waiting, we're thinking about what we can do to keep them happy. Now, I didn't know they were going to sing, as you said, but we could probably arrange that too. On behalf of the family and friends of Johnny Kostic, I'd like to call up Emily to say a few words.
Thank you, Susan. Thank you, Dr. Goodman and Robin Harvey, and to all the other Cooper University Hospital officials that are present here today. It means a lot. And thank you most especially to all of our family, our friends, for your time, energy, love, and support. Not just today, but always. As we were driving here today, I couldn't help but wonder what John would think of today. And I can guarantee you that if anyone were to have told him that there would be a corner of Cooper Hospital named after him in his honor, he just would not have believed it. He definitely would be touched and incredibly proud. But knowing John and how humble he was, he probably would have preferred to acknowledge this day and then moved on with the usual business. But there's so much to be proud of here today, and there's even more to celebrate. Today is about celebrating the convenience and comfort that this new pediatric infusion center will bring to children and families in the South Jersey area. It's a memorial to John, yes, but it's also a testimony to Cooper's deep and lasting commitment to providing family-centered care to children in South Jersey. We are proud that the Johnny Kostic Memorial Foundation has joined Cooper in that commitment, and that this Pediatric Infusion Center will serve as a place of care and comfort, of education and entertainment for families and their children in the area. Under the care of the talented staff of Cooper University Hospital, this facility will soon be providing family-centered care to children requiring short and long-term infusion therapy, therapeutic injections, and other kinds of testing in an outpatient setting. I think we can all say how grateful we are that a hospital like Cooper exists in South Jersey. I know I speak for the other foundation board members when I say that we are so humbled to have Cooper's Pediatric Infusion Center bear John's name. We are all so excited to see the impact that this center will have on families in the area. And again, I want to thank each and every one of you for being here today. Thank you.
That was beautiful. And I'm sure John is thinking, you did well, kid. We are going to open the doors in just a few moments. We'll ask John and Eileen and Emily to sort of walk in first so we can show you. And I think there's some of the nurses staff in the back and who can sort of meet us there and sort of explain what's going on. But this is certainly a wonderful day for all of the children who will come through this site. It's a day to remember, and it's a day to think about what each of us can do in John's honor to make the world better for the next person who comes along. So again, thank you so very much. And we're gonna have a ribbon cutting first, so don't move. Joanne.